Since it's updated here, we can vote. All right, welcome members Daly and Delsasser. Thank you.
Thanks.
Next, we have approval of the October 28th minutes. Can I get a motion? Danny and Rob, thank you. Go ahead and vote.
I vote aye. Aye.
Thank you both. All right, and that passes. We'll move forward to our informational items. Do we have anybody here from the circuit clerk's office? No? Coroner's office? All right, Becky, you're up.
All right. Well, good afternoon, everybody. We are very excited, but very busy on through the end of the year at PCAPS. Thanks to the board passing the fee changes, we have lots and lots to do. We have realized that we have changes to make in our software, changes to make in some of our paperwork, and going through our office and looking at all the things that our fees touches and making the changes associated with that. We're reaching out to our veterinary partners and calling some meetings because as those tag fees change, the veterinarians sell the tags for us in the community. So reaching out to them and having some meetings there and getting those communications out and about. We are also onboarding 2 new associates. We have hired an animal control officer and we have hired to fill our administrative assistant position. So all seats are filled at PCAPS, which we are excited for. And we are still working to get those 2 microchip scanning stations out in the community before the end of the year to complete those 2 grant-related projects that are still outstanding. So we have a lot of work to do before January 1.
I would also add a thank you both to Becky and Shauna. They've been working and reported back to Member Phelan and Scott and myself on polishing the after hours procedures to make sure communication is clear and streamlined on what to do in certain situations. And I know that was quite the undertaking to look at previous numbers and all of that. So thank you both for looking at that. Any questions for Becky? Yes, Danny.
More of a question, but I've just been so impressed at Becky being able to help facilitate and obtain these grants and the bequests and the donations. I was just curious if administration could get us some totals for the year and maybe send that out to each member of the committee.
Happy to do that, Mr. Phelan.
Thank you.
Certainly been on a roll. Any questions for Becky? Okay. Go ahead and stay put. We'll do our resolutions out of order so we can stay on the topic of PCAPS. We will, let's see, move on to resolutions. And can I get a motion for the medical supply donation? Danny and Rob, thank you. Do you want to tell us about the medical supply donation?
Okay,
Great.
This is a $2,500 donation. This comes in from a wonderful PCAPS volunteer. Interestingly enough, it's actually a volunteer family that has since moved away. They've moved to New Mexico, but actually sends back funding to us every year, and chooses not to earmark the funding, says use it for whatever you need the most. And so the staff put our heads together and said we could really use some funding in the way of Giardia testing and treatment for Giardia, which is just kind of an intestinal parasite. And to expand kind of some medical care and look at funding some of the microchip program, the free microchip programming that we do for the community for on into 2026. And so funds from this donation will be used for those programs.
And these donors you'd mentioned were volunteers with the facility who obviously you guys made an imprint on.
Yes, they bonded with us, the Cindy and Joel Peterson. They bonded with the cats and loved the team, loved the area, lived in the area for many, many years. Moved back to New Mexico to support their elderly family and send back a generous donation every year to support the shelter. Very kind.
Thank you. Any questions on the medical supply donation? All right, please vote.
I vote aye.
Member Daly?
Aye.
Thank you both. All right, the ayes have it. Thank you. Now we need a motion for the Dr. Infelt bequest. Danny and Paul, thank you.
All right, Dr. Michael Eilenfeld was a very generous man. Left us in his trust. He was a well-known anesthesiologist in the area. Had a beloved dog that he had registered with us for many, many years, and knew the agency for that. And his beloved dog Molly, and left the funds in memory of Molly. And everywhere he went, he had talked about Molly and just loved his dog Molly, and had that one special dog with him for many years. And so, in memory of his dog Molly, he left us $250,000. Again, did not earmark the funds, so we would like to use this for capital projects in the future at PCAPS.
Which is a great step in that direction.
Yes.
Any questions? We definitely should. Yeah. They don't give us a lot of information about the remaining family. They only give us an address. I've reached out with a letter, which is the best I can do.
Yes, Member Rosenbaum.
Should we put a plaque down there at the animal shelter for that to show because somebody's giving that much?
Yeah. Is there any reason we couldn't put a plaque up in their name or in the family's name or Molly's name? Any other questions on this one? All right. Very exciting. Thank you. Please vote.
I vote aye.
Aye. Thank you both. All right, ayes have it. We'll move on to our PCAPS flea treatment donation. Can I get a motion to look at that? Danny and Sharon, thank you.
All right, and then the Peoria Humane Society, as you well know, funds the PCAPS operation very closely with a lot of medical care for our animals. They often provide medical care for our animals above and beyond what our budget will support. So, for example, if an animal needs medical care above and beyond what our visiting veterinarian can provide, let's say hospitalization or surgical intervention above and beyond what we can do on the mobile unit, then the Humane Society steps in with their funds. They had some funding left over as a part of that program that wasn't spent. They came to us and said, hey, what can we do in the vein of medical that would help support your operation? We all put our heads together and we came up with a test pilot program for an expansion of our current parasite prevention. Right now, we're using very basic flea treatment products for our shelter animals. They're really just, let's get rid of the fleas. But what we'd like to do is expand that to a broader range of intestinal parasite treatments, flea preventative, things that include treatment for ear mites, in addition to just let's get rid of the fleas. And so we will be, this is a reimbursable grant. We will be reimbursed for the cost of those products to the tune of $2,000 to get us through the end of the year so that we can upgrade those products, give that a try, and see if we don't get some better quality care for the animals, and then have to treat treat less of those bugs on the other end. And perhaps the prevention will save us some money in the cure, per se.
Great. Questions? Great. Please vote. Member Alsasser, how do you vote?
I vote aye.
Member Daly?
Aye.
Thank you both. Ayes have it. Thank you. Thank you, Becky. We'll move on to our Illinois Arts Council grant. Can I get a motion? Danny and Rob, thank you. Welcome.
Thank you. I can give a little background on the resolution we have in front of you today. The Illinois Arts Council pushed a notification to the Administrative Office of Illinois Courts in the spring of this year. During the summer, we applied for the grant. The grant is for $12,000. The goal of the Creative Arts Project grant is to support local artists in Illinois. We picked local painter and muralist Megan Corey. She's been selected as the artist for this project at the detention center. She's previously completed several murals throughout her facility, and she's a former Peoria County employee. Grant funds will be utilized to paint 5 murals through supervised resident sessions, and as part of the detention center's behavior modification program, and it's going to promote trauma-informed care with an impact of mental health. Happy to answer any questions.
Will these murals involve any of the youth you have there currently?
Yep, it's going to be Megan working directly with the residents. And Megan's already been out to the detention center ordering supplies, the paint supplies, material, and we're coming up with the ideas to coincide, the murals will coincide with the current BM program that we use in the facility.
Great. So very similar to the one you have currently in the gym.
That's correct. And when they're complete, we will be sending an invitation out for the unveiling for anybody that wants to attend.
Great. Any questions on this grant or the process? All right, please vote. Member Alsasser?
I vote aye.
Thank you, Member Daly. Member Alsasser, how do you vote? Oh, you dropped off. Okay, thank you. All right, and that passes. Thank you. Thank you much. We'll move on to public comment. Seeing none. Miscellaneous? We're adjourned.